If you're having trouble getting patients say yes to treatment, it might be because you're not meeting them where they're at. We're going to talk about that today. We're on the whiteboard, and I'm going to share that so you can have that tool going forward. Hey there, I'm Dr. Ginger Bratzel, and I help thousands of healthcare professionals and practitioners around the country get and keep all the patients they need, more of their ideal patients. And if you're bringing in patients, they fall in one of these categories, and you don't always know where people are at. Let's think about it. I always use this like when I go into a car dealership. When I walk into a car dealership and I'm really looking for a car, the thing they say to me most often that pisses me off is, how much are you looking to spend? The answer to that is, I'm looking to spend the least amount to get what I want. So when they ask me a dollar figure, that totally turns me off. Now, if they ask me what features I was looking for, what purpose I was looking for, and give me some of those criteria, I know they're trying to help me, but they're using the wrong terminology. So when it comes to healthcare, we need to be in their set of criteria also. So if you are wanting to treat them here, but they're only here and you're not talking to each other, you're never going to connect. So we want to have that connection where you can help them get the care they need. You might have a comprehensive practice. You might have a practice where you're trying to help them with all kinds of health things. But if you're talking at this level of solving their problems and they hear blah, 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 or they've already emotionally cut out, and they're not going to listen to you. So if we know where they are, we can start there and we can build that relationship together to get them to where we want to be and where they need to be and to help them out. So let's go through this, talk about the levels. This is where objections come in. And if you are selling comprehensive treatment for them and they're only looking for emergency type services, you will never connect. And that is what's going on. You're hoping your shiny office, your great website, your wonderful team, or just your degrees behind the wall is going to make them say yes. And I will tell you, you got the buzzer on that. So 4 levels of care, no matter what kind of healthcare practice you have, are emergency, restorative, preventive, and comprehensive. So emergency patients are ones just looking to get out of pain. They have one problem. They might have heard great things about you. It doesn't mean they won't become a comprehensive patient, but if you go in too big and try to sell them a luxury Lamborghini and they were just trying to get the Ford Focus and get out of here for now, you are going to lose that disconnect. So one of the easiest ways to do this is to ask them straight out. Now, they might not know these words, but I can ask them on one of the questions where I'm asking their name, their phone number, their email, the date of birth, and all that stuff. I can say, what are you looking for care? What level of care are you looking for? Are you looking for emergency care where you're just trying to get out of pain and move on? You only come in when something's really bothering you. You don't look for anything else. I can ask them that. Or are you looking for restorative? You're looking to take care of what you have. You want a plan that's going to keep you going. You want stability. I can ask them that. No matter what type of healthcare professional, if I was a chiropractor, a dentist, a naturopath, any type of healthcare, I can ask at these levels. They fall in that. Preventative is above restorative. So this is like, I will take care of what's broken, and then I'm not going to see you. Preventative is like, I want a plan to make sure I don't keep getting into trouble. What things do you see down the road? What else should I be doing? And they usually have some kind of a follow-up plan with preventative. And then the last one's comprehensive. And most practices, a lot of doctors, this is where we are trained at this level as a healthcare professional. We are trained at that level. We want to give them the stars, the moon, and all the solar system because we can do that. But they might not be in that place to do that. So I ask them that in a questionnaire with their basic health care information. It might be their first patient interview. I ask them about that because that gives them control. So there we set the tone. Objections are gone. That's not a, hey, we're going to play offense and defense. I'm going to have to jab, jab, jab. I have included them in their decision process. Now, if they say, I only want restorative work, and so that's wonderful, Ms. Jones. If I see anything where I see problems come down the road, would you like me to tell you that? Do I have your permission to tell you that? If we can get you in an even better shape, or if there's an opportunity or something I see that you need could benefit from that. Is it okay if I mention that to you? I got a permission statement to it. And 99% of the time they say, oh yeah, sure. That brings us at the same level. Now we can go on this journey together. Objections are from disconnects. Disconnects in the new patient experience, disconnects in your marketing to what you do when you come in the office, disconnects in what you talk to and present to them, and then they leave out there. We have this blueprint going along the whole time that gives you something to refer back to. As you're talking about things in their mouth, you can say, hey, this falls under preventative. This falls under comprehensive. It gives you a roadmap and a reference point for them to have, hey, I know what's going on and through this. Now, they might be an emergency type patient now, and they might leave as an emergency patient, but that relationship was started. So in your next encounter, we can talk about doing this. People, we are trying to get them to total health. Some people, it's just one step at a time, but other people, it's all at that first visit. But it gives us a roadmap to refer back to so they don't feel like you're forcing something down their throat. They don't feel like you're lying to them or you're trying to overwhelm them. They know where they are on this. And if they're adamant about that, you respect that. That's human nature. But we have that roadmap going through. This is where objections go. This is where they come from, is because we're not on the same page. Now, I did a training like this in detail for my clients in their practice. If you would like a copy of it, why don't you put roadmap down in the comments or send me a direct message with roadmap, and I can send you that training that I did for them and I recorded for them, and it would be really useful for you. So that's my gift to you. You don't need to give me your email address or anything like that. Just put that in the comments where you see this and let me know, and I will get it out to you. Hey, this is Ginger signing off. Till next time. Bye-bye.